Good morning. This is the third session for theological method in pastoral counseling. Today we want to talk about the mental illness and pastoral counseling. We do pastoral counseling because there are people who got who are sick mentally. Pastoral counseling is not limited to mental illness, but physical. In broad concept, pastoral counseling is part of pastoral care. Some people are separating those, but pastoral care has broad meaning, I think. And then pastoral counseling is part of the pastoral care, because pastoral care has bigger concept. Pastoral counseling is focused on counseling, but still the counseling is a way of pastoral cares. That's what I think. But in pastoral counseling, we want to just take care of people who got sick in their mental problems. When people have a mental illness and problems, they need to see a doctor or doctors, but sometimes they need friends, and they need pastoral counselors, or if they are Christians. So we want to just talk about why people have mental illness and what kind of mental illness they have, and how the pastoral counseling can be involved in mental illness. So mental illness, are health conditions involving significant changes in thinking, emotion, and behavior. Mental illness are associated with distress or problems functioning in social, work, or family activities. Well, when we define a concept, we are trying to get everything in there in a short sentence or short sentence. So mental illness, I think that definition is covering everything in mental illness, but there is a very nice one from APA, American Psychiatry Association. So that's the mental illness. Mental illness is kind of common. One in five U.S. adults experience some form of mental illness in a given year, and 1 in 24, which means 4.1%, has a serious mental illness, and 1 in 12, 8.5%, has a substance use disorder. Substance use means alcohol, drugs, some other things, any chemicals, steroid or nicotine, something like that. Mental illness is treatable. Yes, but certain levels, it is pretty hard to take care of them. The vast majority of individuals with mental illness continue to function in their daily lives. So sometimes it's kind of scary. Recently, I just watched a preview, a movie, Unhinged, and I think Mel Gibson was it? No, it's not. It's not Mel Gibson. I don't know. I forgot. The main character killed his wife and someone who cheated with his wife, I think, and then the movie shows that how a person um, have anger management disorder. So he got he got angry. Um, so um, a car, a mom was driving and her son was sitting in the back, and she just honked toward the main character, the guy, um, and then she shouted, and insulted the person. But he tried to explain um, and said sorry to not to move on the left hand signal, but he humbly asked her to say sorry about honking roughly and said n words, but she refused to it, and so he was so he was just trying to chase the car and try to harm I think the boy and the mom. That is kind of a scary movie. Um, so cause because that statistics shows that it is very scary when we drive on the streets because no one knows, we don't know who are driving those cars and what kind of mental illness they have. That's why we don't know, and that is scary. So Unhinged, the movie, um, that kind of incidents can be happened to you too. So because we don't know who's who, so that's scary. That's scary. Anyway, that means also we need to be careful because some people don't know how to take care of their anger and depressions and something like that. And at the same time, we can think that there are some people who need our help, who need pastoral counseling. Unfortunately, as I said, the secular counseling cannot contact the patients or clients or potential, you know, clients ahead, but they have to wait until those people come to them. But pastoral counselors can contact them proactively, which means which is great for those people as long as pastors or pastor counselors have good enough energy and passion to help those people. Okay. Mental health is the foundation for thinking, communication, learning, resilience, and self-esteem, and key to personal well-being, relationships, and contributing to community or society. Many people who have a mental illness do not want to talk about it because they feel shame. Well, when we caught a cold, we say I got a cold. When we got kind of I don't know what happened on my hand, but I got scratches on my hand yesterday and bleed a little bit. When excuse me, when I got hurt like that, I can tell people I got scratched yesterday and bleed a little bit. I mean, yesterday or something like that. I can't talk. But people are feeling kind of ashamed when they open their illness, mental illness. Excuse me. Then that is the problem for those people who got sick. Cause if they have when they just open their mental illness, they can find the doctors or they can get help from others, but nobody knows what is happening inside of those people, and it is very hard to assume or think they need our help or not. So that's kind of it's kind of complicated. But mental illness is nothing to be ashamed of. That's why it is a medical condition, just like heart disease or diabetes. The heart disease and diabetes must be more serious than like mental illness, because heart disease and diabetes can kill people, but the light level of mental illness don't kill people until it can be triggered with something serious, and then it's gonna be a different story though. We know, and mental illness are treatable. Not all, but most of them are treatable. We now know much more about how the human brain works, and treatments are available to help people successfully manage mental illness. Well, a long time ago, people don't know. People didn't know what's happening in our brain. It's because it looks like a kind of a thick old noodle, and maybe tofu texture, and because we didn't know what's going on in our brain, but our brain controls many things like thinking, feeling, and controlling our bodies. Um, but nowadays, science developed a lot, so we know not all, but pretty much about what's happening in our brains. So psychiatrists are focusing on brains and even counselings. So that's you know that that means you guys say you have depression, eat this medicine. I have anger management disorder. Oh, you better eat this medicine. Well, it's not that simple, but people want to just control our brain with chemicals. But still, pastoral counseling or any level of counselings are very helpful to those people who have mental illness, because people want to talk and they can get comfort from counselors and get some solutions, and they can get some ideas of what to do and what not to do. Okay? Okay. And mental illness doesn't discriminate. Mental illness is not only for poor people. Well, we can find certain or particular groups, and maybe people and particular group of people can get more vulnerable to mental illness, and uh, they have more mental illness or particularly mental illness or something like that. But basically, it's not discriminating, which means poor and the rich, any social status, ethnic, city and race or gender, it doesn't care, but they have it's happening to all those people. Okay. While mental illness can occur at any age, three-fourths of all illness begins by age 24. Um, well, it's hard to say why the age 24. Well, that's basically after the high school, and they got college education, or they got basic training or education for their jobs, or that's the beginning of their real social um, um, relationships. I think that's why they have responsibilities on their lives and their families. So I think that's the turning point to that's the big transition of human people's living. So that's what we are guessing. And it is not always clear when a problem with mood or thinking has become serious enough to be mental health concern. Okay, so today, for example, today I'm feeling no good. I don't know why, emotionally, feeling down. It doesn't mean that I got depression, because it's happening today. I was okay yesterday. I'm not sure what's gonna be tomorrow, but today I'm feeling kind of down or low or got depressed a little bit. So um, melancholy, melancholy. I'm not quite sure about the melancholy or goli. That's feeling kind of a blue. But if there is melancholy that's disease or sickness. Okay. So today I'm feeling melancholy. It's okay. It's normal. We are not supposed to be happy every day. We're gonna get tired, I think. But when I have when I'm feeling bad for many days under certain circumstance, and it can be sickness and disease. That's all. Okay, schizophrenia. That is sickness, disease. That's from I think Italy, Romans. So when we feel sickness, disease, most of them are ending with a. Melancholy uh, schizophrenia. Okay, like that. Sometimes, for example, a depressed mood is normal, yes, such as when a person experiences the loss of a loved one. You lose to your mom today, and you are very happy. That's abnormal. You lost to your mom, and you are feeling really sad. That's normal. Okay, you got depressed. That's normal. If not, you got a problem, or you had really bad relationship with your mom. Even though even under the kind of situations you are supposed to feel depressed, and I think that's what normal people do. But if that depressed mood continues to cause disease or gets in the way of normal functioning, the person may benefit from professional care. So that means people when they are under depression, they cannot sleep. Well, I'm gonna just take care of that, but it makes body problems and relationship problems. It can make social problems and physical problems. Then it takes long, and we can see that's depression. Okay, common mental illness. There are common mental illness. Mental illness take many forms. Yes, some are fairly mild and only interfere in limited ways with daily life. So I feel really bad. I cannot work today. I'm gonna take a day off. Okay, that's understandable. Okay, such as certain phobias like abnormal fear. Other mental illness are so severe that a person may need care in a hospital. Yes, they need the hospital. When we got sick, when we got heart problems, we need to take care. We need care from hospital. Same thing. Mental health conditions can affect different aspects of a person, including personality, thinking, perception, mood, behavior, or judgment. So when they got anger, management problem, as I said in the movie Unhinged, then the person does not know how to control it, the revenge or chasing the person, the target, and maybe the guy was thinking that I'm gonna kill the lady no matter what or something like that. Mental health conditions can affect the different aspects of person. Yes. The following are short descriptions of some common mental illness. That those are very common. Anxiety disorders. Anxiety is a reaction to fear or stress. When you are under fear and stress, you feel anxiety. Everyone feels anxious sometimes before the before the test and driving test or written test or oral test interview, and they feel anxiety, right? So some people go restrooms often. Okay. A person may feel his or her heart beating faster, beat 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 beat. So uh, some students have anxieties, and they got kind of strong and uh, frequent heartbeats. Um, when they got, because they just worry what if the teacher or professor asks any questions to them, right? Or maybe short of breath or feels sick. Normal anxiety can usually be controlled and doesn't last much longer than the situation that triggers it. Okay, that's normal. It's normal. So you can get used to it, and you can just figure it out how to relax. Some people smoke, some people drink a little bit, not too much, and some people just control their breath, or sometimes some people just meditate and read, or run, or something like that. They can control it as long as those are minor. When anxiety becomes excessive, involves unfounded dread of everyday situations and interferes with a person's life, it may be an anxiety disorder. Nearly 30% of people will experience an anxiety disorder at some time in their lives. Anxiety disorders take many forms. Okay? Alright. So you got anxiety, but you can manage it. So you can have regular or daily common lives. It's okay. If you cannot do it because of the anxiety, and it lasts long, like 2 weeks, 4 weeks. We need to think about. We need to watch what's going on and for how many days those things, symptoms are going on, and then you can decide. So you got anxiety today, and you cannot diagnose that as anxiety disorder right away, because it takes time to watch it. Okay. Panic disorder is a sudden attack of fear or terror. Symptoms may include a pounding heart, sweating, weakness, dizziness, or sounding sensations. People having a panic attack often fear they are about to be harmed and feel that they are not in control. Okay, panic disorder. And obsessive compulsive disorder. So obsessive compulsive disorder, what's called OCD, involves frequent upsetting thoughts. That's obsession, and that cause anxiety. And people do, something. They do repeat this or this and this or this. Those are compulsion to try to control their thoughts and anxiety. For example, or they just shake their, or this, or they just shake their heads like this, or just usually people do this, because they want to just, calm down themselves, so they do this, For example, a person might be afraid the stove was left on and return again and again to check. You turn the stove off. Yes, you did. And you just step out of your house and you're thinking, did I turn that on or not? Did I turn it off or not? And they just come back to home and make sure that is, and they just check the knobs. That's obsessive compulsive disorder. Gonna be minor. Social anxiety disorder involves extreme anxiety around others. A person may be very afraid that they are being watched or judged by others. So no one is watching the person, but the person is thinking that people are watching me, or what they are talking about me, something like that. And the fear of being embarrassed may be so strong that it disrupts relationships, work, and other activities. And because they are thinking that others are talking about those people, and if I think somebody is talking about me and just something a little bit bad or judgmental talking, how can I have good relationship with those people? Agoraphobia involves avoidance of situations where escape may be difficult or embarrassing, or help might not be available. That's agoraphobia. If panic symptoms occur, the fear is out of proportion to the actual situation, lasts 6 months or more, and cause problems in functioning. Specific phobia is an intense fear or anxiety that is out of proportion to the actual risk or danger posed by object of the fear. For example, I have a phobia on rats, snakes. Those things, I hate those things. I'm not sure, but I don't think I can just clean a dead rat even, because I watched the wrong movie. There was dirty movie, and I saw rats in the movie, so I hate it. And some common specific phobias are fear of enclosed space, like so those people cannot use elevators or airplanes. Open spaces, that's kind of opposite, so they cannot go open spaces, but they just stuck in a enclosed space like a home, or so they don't want to just go outside. Heights, so they cannot climb up the mountains, and they can't live in an apartment, except that is first or second floors. And flying, blood. When they see blood, they go crazy because they have a phobia. Generalized anxiety disorder involves excessive anxiety and worry more days than. Now, for at least 6 months, the worry is about a number of events of activities and is hard to control. The constant worrying causes distress and disrupts relationships, work, and other activities. That's why we call those mental illness. When we got sick, we can't work. When you caught a cold, when you got a flu, you cannot work. Same thing. If you got sick, you got problem in here, you cannot work properly. You cannot, keep the regular relationships. The same thing. But why people are thinking mental illness is kind of shameful? Because once they got confused with the demon possessing. Okay? Mental disorder is mental disorder. Physical disorder is the same, it's about the same to physical disorder. Okay, both of them are treatable. Well, there can be some, limitations beyond the doctor's abilities or counselors can do, but most of them are treatable. But people are thinking that is the mental illness is a part of demon possessing or kind of a shamanistic approach they have. That's why people thinking mental illness is kind of shameful. But that is curable. That is treatable. Okay? Don't have to just worry about it too much because lots of people, as the studies shows, lots of Americans, 4%, 8%, those people, 1 out of 5, those people have at least minor or a little bit severe mental disorder a year. So those are kind of popular. Okay? Just think about the 1 out of 5 cars are driven by certain level of mental disorder. Can you drive? It is differently the careless driving, but both can kill themselves and others too. We don't know what's going on, and that depression is kind of a big one. Depression. D means depression. 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 Press means press or press. That's press, right? D means down. And press means kind of, like a press, Press. So depression means people. This is what I just think. People are supposed to walk like that, but they got shrunken. Something like this. Because they are sick. Because they are ill. So they just do this. Okay? People just think like this. I never seen any people who got depression just who act like that. I never seen those people. If you see any people, standing like this, it's hard to say that people, the person has depression or not. Okay, so depression means depressing, something like that. So it is hard to go up. Okay, because those people got depressed. Depression is what's called a common cold. Common cold. Because cold is popular, and it's like it's like a cold. You don't cough, you don't have a runny nose because of the depression, but it makes people kind of feeling like the person got a cold. No fever, no feeling cold, but it makes people, hard to have regular lives because they are sick. Okay, depression is a potentially serious medical condition that affects how a person feels, thinks, and acts. Feels, thinks, acts. The primary signs of major depression are the person feels sad or has no interest to pleasure in normal activities for most 2 weeks. Activities such as eating, socializing, sex, or recreation lose their appeal. Other symptoms are these: changes in appetite, sleep changes, and agitation. They sleep a lot or they can't sleep. Agitation, restless, or changes in motor movement, feelings of worthlessness or guilt. Problems thinking, concentrating, or making decisions, lack of energy, fatigue, thoughts of death or suicide. Those are all kinds of symptoms, those are not only depression symptoms, but those are symptoms. So when you have some of them, at least 2 weeks, then there is the problem. Okay, there's a problem. Depression is more intense and long-lasting than normal sadness. It can develop slowly, draining the energy, pleasure, and meaning from a person's life. About 7% of adults experience major depression in any given year, and 1 in 5 women will experience it in their lifetime. Some people may express depression differently. For example, some people who are depressed may be more likely to complain of body aches, sore body, or something like that, or any fatigue. Other physical symptoms than of mood or emotional symptoms. Like anxiety, depression can take different forms. So when you see those kind of person, you not just call the person as a depression? No. It's hard to say that. So when we diagnose this, we're gonna just take care of the mental illness diagnosis. When we just give diagnosis for those kind of symptoms, we need to be careful. Because when we diagnose it as depression, we're gonna the medicines are different with anxiety. Okay? Those are different. When you got cut, you put the ointment on it. You don't need the Advil or something. Well, you can if you got pain. If you don't pain, but you got scratches. Then you don't take Advils. No way. Just put some ointment. Or just rub it. I do that sometimes if I don't have anything. I think it is no good idea, but I do. Okay? Major depressive disorder causes a person to feel deeply sad and unable to enjoy previously enjoyed activities for at least 2 weeks. Jobs, relationships, and life activities can be affected. That's right. And persistent depressive disorder is a milder form of depression that persists for years at a time. People with dysthymia may feel gloomy. That is crazy, gloomy, irritable, or tired much of the time. They may feel hopeless and have difficulty sleeping or concentrating. Their depressed mood can interfere with their relationships, work, and enjoyment of life. Postpartum depression refers to symptoms of major depression in a mother just before or after her baby is born. So we need to take care of those moms because when they got pregnant, their bodies are changing a lot and hormones and cause mom's body is trying to help the fetus and baby. So the mom's body is sacrificing because the baby is eating the nutrition from their mom. So hormones are different and body shapes are different and eating habits are different and sleeping times are different because somebody in their stomach, womb, I mean. So they have difficulties. So they can have postpartum depression before and after. So it is hard to say, but but the mother after the giving birth killed the baby because of that kind of depression too. I think that there are many things that involve like the mom has no financial has financial difficulties to feed those babies or something like that, and then there are so many things can be involved. And then that is pretty sad when moms have those kind of difficulties. It is hard to say that um, they they have so the basically um, we need to we need to uh, take care of take care of those people, especially the moms. What about the bipolar disorder? It is a little bit harder one. Bipolar disorder can cause dramatic mood swings from feeling high and energetic to feeling very low, sad, hopeless. The periods of highs and the lows are called episodes of mania or hypomania, lower grades of mania, and depression. During many episodes, a person may speak rapidly, feel little need for sleep, and become involved in activities with a high potential for risk or pain. So they can jump from the cliff to the water and become involved in activities with a high potential. I mean, during a depressive episode or low, a person may feel despair, hopeless, and fatigue. People with bipolar disorder are at higher risk than the general population for alcohol or substance abuse or misuse. So bipolar disorder, that's pretty tough one too. schizophrenia is getting popular, and that is very um, kind of complex. And Christians and other religious groups want to um, just see the difference between schizophrenia and um, the demon possessing. Okay, schizophrenia is a chronic, serious mental illness that usually begins in persons' 20s. When untreated, it can cause people to have psychotic thinking, impaired perception of reality and ability to communicate, and delusions like fixed false beliefs or hallucinations, seeing or hearing. There is nothing but they saying they see something, you know. So when they do this or do this, which means and ask them, you know, they answer. They answer. They have lots of flies or clouds or something like that, but you don't see that. It's hallucination. Some people with schizophrenia do not recognize that they have a mental illness because they think those are normal. Because they see something, so they just do this. It's normal for them. If you have flies near you, you do this, right? And you see the flies and you do this. And they see flies, but flies are not there, apparently. Because they see, because of the hallucination, they do this. And so it's normal for them. It's abnormal for, for us to see that, but it's normal for them because they see. And some people with schizophrenia do not recognize that they have a mental illness, and treatment can help relieve many symptoms of schizophrenia. But most people with this illness cope with the symptoms their entire lives. Nonetheless, many people with schizophrenia live successfully in their communities and lead rewarding lives. But if that is kind of serious, they cannot do the daily lives, but they need kind of a special help in hospital setting. So that is different story. What about the post-traumatic stress disorder? That's also called the PSD syndrome. So PTSD, post-traumatic, after trauma. Yeah, post means after, right? After trauma, there is the stress disorder. For example, lots of soldiers from Iraq or in a battlefield, they just saw something horrible, like they had to watch their friends or the co-soldier. I mean, the friends are, dead in the battlefield, and they got trauma, right? When you see lots of blood or just disconnected or just failed to hands or legs or hands, they can get traumas. Those are traumatic events. When you see a car accident on the street, that's traumatic too. It can be traumatic. Oh, something happened. It's okay for you, maybe, but if you take those serious and you got anxieties or kind of fear because that can be happened to you anytime unexpectedly, it's pretty sure because so lots of people are dying on the street because of the car accidents. Okay, so that's traumatic. It can be traumatic. So after the traumatic event, post-traumatic, after the traumatic event, you are under big stress. So you can't sleep. You are sweating during the sleeping. And you cannot just focus on your regular lives or daily lives. You cannot do anything but worry or anxieties. That's PT. Excuse me. That's also called the post-traumatic stress disorder, PTSD. People with PTSD may start to easily or be unable to feel positive dimensions. So when you watch some movies, you can just see a soldier right after the battlefield. They sleep, they just startled and wake up from the bed and jumped out of the bed or they sweat. That's PTSD. We are supposed to support those soldiers from battlefields or in battlefield so they can overcome those traumas. Okay, they may experience flashbacks of the event that triggered the disorder and be quick to anger. So they just remember, they just remember the scene, like taking pictures. You just take a, just feel that and they got angry easily because that was so traumatic. Okay. Addiction, substance use disorders. As addiction is a chronic brain disease that causes compulsive. You drink a cup of wine a week. It's not alcohol abuse or addiction. I just saw alcoholic and he drinks every meal. In every meal. 1 or 2 bottles per meal. Or half a bottle of liquor a meal. It's alcohol. That's a chronic brain disease. You have to drink, every day or every meal. So you're gonna get drunken lightly whole day, 24 hours. As a result of research, we now know more about how addiction affects the brain and behavior. Yes, you got addiction because we felt really good. We felt something really good. People smoke because they took a time for 5 minutes or 10 minutes by themselves or with friends. While they are smoking, they are standing there or sitting there and they're actually breathing out. I think people are smoking because of the breathing. When you do sigh, and people gonna see you, strange way, and they think that you have a problem. But when you just do, people don't think that you have problems, but you are smoking. Well, I think nicotine is the main factor of substance abuse, but I think people are smoking for breathing out or a way of sighing. Something like that. That's what I'm thinking. They can hide their sign with breathing out the smoke or puffing out the smoke. That's what I think. There are lots of addictions. Addictive disorders including substance use disorders and gambling disorders. Gambling, it's hard to fix it. Mental illness is defined in Diagnostic and Statistical Manual of Mental Disorders. People take drugs for a variety of reasons: to feel good, to feel better, for example, overcome distressing feelings, to do better out of curiosity, or because peers are doing it. An initial decision to take drugs is usually voluntary, but with continue to use, changes take place in the brain, impairing a person's self-control and judgment. At the same time, the addiction produces intense impulse to take drugs. So when they need nicotine, they feel kind of discomfort and feel anxiety. So they need something. So they have to smoke. So when kind of drugs and alcohol are about the same. So they have to do it. It's addiction. Many people experience both addiction and another mental illness because they do substance abuse because they have a mental illness problem, or they because of they addicted to certain substances, and they have other problems too, physical and mental. Mental health conditions may precede addiction. Drug misuse may also trigger or exacerbate mental illness. Stopping drug use is just one part of the recovery process, and relapse can occur often during the recovery process. So substance abuse treatment is okay, but at the same time you need to fix the post-traumatic PTSD or any relationship problems. Because you have relationship problems, you are drinking. So drinking, okay, but what about the relationship problem? That triggered substance abuse. So we need to be careful when we see mental illness. So because there are many things can be involved. So mental illness can be very complex. Addiction affects many aspects of a person's life, so treatment must address the needs of the whole person to be successful. These needs could be medical, psychological, social, vocational, and spiritual. Treatment may include behavioral therapy, so you need to do something for recovering from the mental illness. Motivation interviewing and medication and should be tailored to the individual's circumstances and needs. That's customized. Support groups such as AA, Alcohol Anonymous, or Narcotics Anonymous, and others are the central part of recovery for many people from APA. So those are very crucial. So we need to be careful when we see those things. And so those are mental illness. So what the pastoral counseling can do? Pastoral counseling is not only for spiritual thing. That's for whole people. I mean, wholeness of people. So pastoral counseling, when the secular counseling is focusing on the certain particular problems, but pastoral counseling is more, I think, more. It has to be more focused on the current situations and spiritual stuff too, situations too. If you don't have a good relationship with your wife or girlfriends or husbands and boyfriend, you can have a certain level of mental illness or anxiety or angry or something like that. But what if you have a problem with God? But what if you have a problem with your God, whether that is Christian God or Buddhist God or whatever? You will have other problems because of those two, and that is very complex. Because you are disappointed with your God, then you can that makes some other problems, and it can be very hard for them. Okay, something like that. Okay, so so we just finished the mental illness, and then pastoral counseling. Counselors have to know those kind of things, and as much as we know, we can help people, more. That's why we are learning for that. So I hope this helps.